Welcome to today's episode of DermTalks, where we meet great dermatologists around the U.S. who are redefining dermatology. We're excited to introduce Dr. Dina Strachan, a board-certified dermatologist and the founder of Aglow Dermatology. Dr. Strachan is a celebrity in the dermatology world with extensive experience treating patients of all skin types. She's known for her expertise in treating hair loss and using her voice to contribute to the field through media appearances, teaching, research, and public speaking, both nationally and internationally. She's also known for her devotion to helping underserved communities, specifically the African American community. We are excited to have her on the podcast today. In this episode, we will unpack her expertise to address hair loss for her patients. Dr. Strachan, welcome to the show.
Thank you. It's a pleasure to be here.
Yeah, we're so excited to have you on the show and kind of also be in your office here in New York City. Well, let's take it all the way back to where your career began and how you found your love for dermatology.
Well, my path to dermatology was a little different than a lot of people's. I was in medical school in the 1990s during the AIDS epidemic, and I came to dermatology from my interest in AIDS. Your skin is your largest organ, and it's also an immune organ. So over 90% of those patients were getting skin conditions. And so when I was working on the AIDS service, we were always calling dermatology. And I was so impressed that they were able to solve problems that we couldn't.
So what did that transition look like for you? What was like the beginning, and then what was that next step after your work with the HIV and AIDS patients?
Well, it's interesting. It wasn't necessarily a transition because I went into dermatology. I decided to go into dermatology, and I was actually an AIDS dermatologist for the first part of my career. I trained at UCSF in San Francisco, and during my residency, I saw the transition from, not having great medications available for that population. We had a separate clinic in the dermatology department for the HIV positive patients because they had such unique and more severe complex problems, and just watching all of that disappear with great medication when highly aggressive antiretroviral therapy was introduced in the mid-90s, and people were going from a death sentence to recovering.
That's amazing.
And not having a lot of, among other problems, not having all the skin problems that they had been having.
What advice would you give to other dermatologists across the U.S. to help relay that knowledge that you have?
So when I came out, board certified, there wasn't as much available to help patients with hair loss. But fortunately, where I trained, I didn't realize that this was actually very in-depth training and that I was privileged to get that kind of training. We got very extensive hair loss training, but dermatology, skin, hair, and nails. So I figured, this is just bread and butter dermatology. I didn't realize that not everyone got that. So when I went out into private practice, and I was treating hair loss patients, it was just, something I was expecting to do. The patients were happy, and they had found someone who kind of was going through the whole process, not just offering them, one thing or telling them that there was nothing to do, but actually going in depth with them. And then they would get results, and then they would tell other people. So they told me I was a hair loss expert. I didn't know.
Are you seeing a difference in your patients wanting to do something about the conditions or symptoms they're experiencing instead of just saying, oh, this is life, I have to deal with this?
I would say that people now know that there is something that can be done. And so they come in with that awareness that there are many things that you can do for hair loss. And when I started my career, people kind of came in resigned and just, they're coming in thinking, well, maybe she has something, but I doubt it. Or I've talked to so many people and they keep telling me the same thing. Now they're aware that they're just many options. It's been decades, there should be more, things should evolve, and we have more information now, and we have more capability now. So I think people are aware of that. And I'd say the thing that made people the most aware was what I call the slap heard around the world at the Oscars, that kind of brought out that conversation about hair loss and how people suffer from it. And even people who are, privileged and have access to things were struggling. And I think that really opened up the conversation for a lot of people.
Right. And I think when more people speak about it, then more people take notice. What are some of the latest advancements in hair loss treatments that you find most impressive or promising?
What I find most impressive is the new knowledge we have and the deeper insights we have about diseases. So, with respect to hair loss, not just telogen effluvium that we know is tied to other medical problems, your diet, surgery, infections, autoimmune conditions, but for example, information about how people with alopecia areata are more prone to hearing loss.
Oh, okay.
How diabetes is connected to CCCA, central centrifugal cicatricial alopecia, probably because of the inflammation it causes, or the correlation between fibroids and CCCA. That type of information, sort of tying the symptom of losing your hair, or the sign rather, of losing your hair with other things that are happening in the body, rather than just thinking of the hair as vanity.
Mm-hmm. Yeah, that's something that's like for us when we were speaking from the pre-interview that we had, when you brought up inflammation, that was something that I think kind of sparked a little light in my mind too. Like there's so many underlying causes. Like I think sometimes people don't connect the dots until, they come see a board certified dermatologist and then they realize that there's underlying causes of things. Specifically inflammation with CCA. How do you see that once you are able to educate your patient and things like that? Are there things that they can do like outside of dermatology medications and things to have a better understanding of what's causing their inflammation?
Absolutely. I mean, there is information. This isn't with CCCA, but I believe there was a study in China on men who drank sweet drinks, sugary drinks. They were much more likely to have severe androgenetic alopecia than men who didn't. The association of CCCA with diabetes and, a high glycemic diet, which causes inflammation in the body. So, the importance of managing all of those things and how it affects multiple organ systems, including your hair, because hair is often dismissed as, oh, it's just hair. But, hair is we're social animals, and hair is something that represents health, wealth, safety, all sorts of things, a stage in your life. So it's actually a reflection of a lot of things about our well-being.
Mm-hmm, for sure. And I think for so many people, it's a huge emotional factor in the day-to-day. So
yes,
I'm sure you're giving confidence to so many people. Staying on the trend of technology, AI and other technology seems to come up in every conversation, of course. I'm sure you're talking about it every day. What are some things that you're seeing that's making an impact in preventing or treating hair loss? Maybe newer discoveries or?
Well, I'd say that with respect to hair loss, I know that it's being used in research. So I know that there are AI systems that are used to analyze photographs to detect changes in hair growth that can't be detected by the human eye. That it's being used in robotics to treat hair loss. Sometimes I believe there's some AI systems that do hair transplants. But I think, my concern with AI is that I believe technology should be our servant, not our master. And I think it needs to be regulated and it needs to be vetted. It needs to be held to the same standards that a person who goes into medicine is held to, or medication.
Yeah.
It needs to go through a process before it is made the standard.
Yeah.
So other technology that I think is really hopeful, it's already here, is red light therapy. It's very effective. There are many systems out there that are FDA cleared, and they've been studied outside of their FDA clearance on other medical conditions, other types of hair loss. Things are usually FDA cleared for androgenetic alopecia, male or female pattern hair loss, but of course we're treating many other things. And so I really like using that in my practice because, one of the things is there really aren't side effects with that. And you can use it in someone who's pregnant. Some people who are who have a type of hair loss, they get it early in life and they're going to have it for the rest of their lives. We don't have a cure for it. So there's nice that there's something available that they can maintain their treatment throughout their life. So the red light reduces inflammation, increases blood flow, and affects the DHT.
In recent interviews, you speak on hair detoxification. Many people experiencing hair loss may not consider a hair detox. What would you tell them?
The hair detox is really a scalp detox. It is basically making sure you remove things that are causing inflammation or causing irritation on the scalp. So the scalp is sort of the soil that the hair grows out of. And when you have inflammation, just like I was saying with the red light, it reduces it because that helps foster hair growth. That will reduce the inflammation that can get in the way of someone having optimal hair growth. So it could be removing excess product. A lot of people use a lot of product and that builds up on the scalp and that will cause inflammation, or removing dead skin cells or excess oil from the scalp that feed yeast and cause inflammation and dandruff.
Yeah, it's so good to know. I feel like sometimes people don't consider all the products they use on a daily basis, what happens after you're wearing dry shampoo for 3 days straight, or
Exactly.
gel or hairspray and things like that. I think sometimes people just assume it just goes away after washing your hair in the shower, but maybe it's not so
I mean, it might. It just depends on the type of product you use, how heavy it is, what it is exactly. There's so many options now. So, and also how frequently somebody shampoos.
Or what are some helpful tips that you could share for people to maintain a healthy scalp and kind of eliminate those irritants or things that are causing them inflammation?
Well, in terms of, scalp care and hair care, you have to think about one, the texture of your hair, because there'll be different requirements and different risks depending on whether or not you have straight hair or curly, kinky hair. Straight hair tends to get oily because the oil from the scalp can slide down. The hair is going down, so gravity pulls the hair down. And then curly, kinky hair tends to be dry, but that means the oil pulls on the scalp. So people with curly or kinky hair tend to get dandruff more because they get more buildup. However, what's ironic is that the people who have the oil on the scalp should not shampoo too much because that will dry out their hair and cause their hair to break. So it's balancing that. So if you have straighter hair, some people shampoo every day. I don't know if that's something you should do if your hair is long. Maybe if your hair is shorter and straight, you could do that because you're going to cut it off before that gets to be damaging. But you can get away with doing it a couple times a week. People with curly or kinky hair shouldn't use shampoo more than once a week. But there are other products you can use like cleansing creams and co-washes.
You've been prescribing SKNV topical medication since our beginning and have been dispensing directly to your patients, right?
Yes. I both dispense and prescribe.
Some dermatologists and patients, they want to go for maybe right away, right to the aggressive treatment options, versus, starting with topical medications, giving the patients the options of seeing how that can make an impact for them. So can you explain your approach to this?
I like to start with the simplest, the most value up front. I don't really see a need to go aggressive immediately. Some people have problems that are short term, that you can just give them a prescription for something to use for a couple months and actually it's gone. It's not a chronic problem. Other people, they may have a chronic problem, but still they may get a lot of benefit just from the topical. And then you have less of a risk of a side effect, and it's actually a lot less expensive. So, often I say to people, you can start out with the solution that's about $50, or you can start out with $1,000 solution.
And that's
it's up to you. I can do either one, but
I would say $50 appeals a lot more than the $1,000.
Yeah. I mean, if that works, then why spend $1,000?
Right. What SKNV medications in particular are your go-to?
Well, I definitely write Oxipod the most because I have so many patients with CCCA and, central centrifugal cicatricial alopecia, which is an inflammatory hair loss. And so I use that to just see if we have some salvageable hair follicles, because that's a scarring type of hair loss. So some of the hair follicles are dead, but there are some that are not dead, but damaged, and they're not producing hair without help. So I start with that. And I write some of the bleaching creams as well. And, over the years, it's changed because, sometimes it just depends on insurance things. So there was a period where I probably wrote more sulfa washes because I love sulfa washes. And patients couldn't get covered for that, but I really thought they should get that. I like the idea that the SKNV products are a predictable price. So I can pretty much tell them a ballpark of what something is going to cost, and they can decide whether or not they're willing to make that investment.
When you mentioned like the bleaching medications, could you speak to like the potency options for those?
You have a number of different potency options. And, some have like 8% hydroquinone with, tretinoin and a topical steroid. Some are without the tretinoin. Some are just hydroquinone. So it just depends on what else the patient is using. Sometimes I have them on a retinoid already, so I don't necessarily want the hydroquinone to have a retinoid in it.
Right. Skin V medications in general, what benefits are you seeing or do you see bringing into your practice?
So from my practice, one, it just makes it very easy for the patients to be able to offer them something that is not just generally available. And I know exactly what they're going to cost, and I know exactly how they're going to get them. I can dispense them in my office if I didn't sell out already, or I can write a prescription. And it's very nice now that you all have that in the system, that even when we dispense them in the office, we can keep track in the same system, the prescribing system, that we would send a prescription to your pharmacy. We can go in and put in our lot numbers. So that makes the counting of the inventory very easy, keeping track of everything very easy. And then it's also all consistent in the patient's chart in the EMR. So that I love.
Yeah. And then on the patient side of things, do you see more compliance with their treatment plans because they're either leaving your office with it, or you're dispensing it directly to their house and they don't have to go to the pharmacy? Do you think that they follow along a little bit better?
I would say definitely. I mean, either when it's delivered by you or they leave with it from my office. The other thing too is that you are offering things that are not available so readily. So sometimes I'm combining things, and some of those things might be things patients buy. And so there's a question mark as to whether or not they're getting it or getting the thing that I told them to get. So I like that it's one product, which also helps with compliance. They're strong, so you can use a lot of them once a day, depending on what you're treating. And so it's been studied that the fewer times someone has to do something, the more likely they are to be compliant.
Right.
So I'd rather give them something strong that they use once a day, and they don't have to combine things. They don't have to get confused. It's like, use this once a day.
Simple. Just eliminating any room for questions or like, oh, was I supposed to do that in the morning and night or just at night? Or
can I combine them?
One time, whenever time it works for them. Speaking on Skin V RX, the topicals that we offer, how would you describe them or recommend them to other dermatologists? And what advice would you give for incorporating these medications within their practice?
I would say that they're high quality compounded medications. And, I've written compounded medications from various pharmacies over the years. And I'd say that your products are high quality, consistent. I have not gotten complaints from patients about them, sort of falling apart or changing in their consistency or anything like that. They've been very consistent. And it's just very easy to incorporate Skin V because you have so many options. You can dispense them in the office. You can prescribe them. If you run out in the office, you can prescribe them. Everything's in your system. It's just very nice.
As we conclude this interview, knowing that dermatology is one of the most difficult and competitive fields to get into, what are the important nuggets that you would give students to help them stand out and succeed?
I would say that they should know why they want to go into dermatology. Dermatology is very competitive, and I think people have this idea that it's easy. They get an idea of what the field is by watching social media, and that's sort of showing a glamorized version of it. It's actually a high volume specialty, so you have to be able to handle that. Your nervous system has to be able to handle talking to lots of different people. You move a lot, so you're doing procedures. You have to be able to handle, I wouldn't call it multitasking, but pivoting from doing a consult, examining someone, doing a procedure. That's not for everybody, and it's not just cosmetic. I mean, it's everything. You could do hair, like cosmetic hair transplants, or you could deal with someone with a blistering skin disease where their skin is falling off, or you could be dealing with someone in the hospital who's a transplant patient who's getting a bizarre infection. So it's not all neurotoxin and bonbons.
Right. I feel like that the way you said social media is, that's just a glimpse, that's the glamorous side. And, everyone shows the parts everyone's interested in and, what appeals, but there's, the hustle and the grind and, taking the time to, serve each patient that you have, no matter what the need is.
You have to be interested in it.
Yeah.
With hair loss, because you'd asked that in the last one, one of the things that's changed a lot is that people, well, I don't know if it's fully changed, but hair loss was often approached as just like, oh, it's hair loss, here, use this. That people don't diagnose it. And that's been one of my pet peeves. Like, if you've got hair loss, you need to get a diagnosis.
Right.
That alopecia is the same thing as hair loss. So that's something I think we should plug to hair loss patients, that they should get a diagnosis for their hair loss and not just have someone. And that's when you often get into those $1,000 treatments where people are like, oh, you have hair loss. Oh, I can treat that. And they get excited, but they didn't diagnose what the person has.
Right.
So hair loss isn't just one thing. I mean, people, use the word, they come in and say, oh, I've been seeing a doctor for alopecia. I said, well, that means hair loss. What's your diagnosis? And they say alopecia. And alopecia is just the medical term for hair loss. There are many types of hair loss, just like there are many types of infections. So, hair loss could be genetic. It could be something that's related to your diet, like a nutritional deficiency. It could be syphilis. I mean, I've diagnosed lots of people with syphilis, and their first presenting problem was hair loss. It could be your thyroid disease, lupus. Sometimes it's a medication. It could be a protein deficiency. It can happen after you've had surgery or after a pregnancy. So you actually want to know why you have hair loss. And then in terms of, some of the scarring hair losses, if you don't diagnose it and start treating it, you can get permanent irreversible scarring. So it's not just one thing, and it's not just like everybody uses the same thing for hair loss. You do want to know why you have hair loss. And maybe it's just, there's certain life changes that people go through. So probably half of women will experience hair loss at some point. Androgenetic alopecia or female pattern hair loss usually occurs before you're 40. But there's something that looks very much like that around the age of 49 that some women go through, and that's perimenopausal hair loss. And then some women around the age of 60, their hair kind of just diffusely thins. Their body's like, I don't want to make this anymore. That's kind of a senescent hair loss, but and you can treat those, but it's just sort of understanding what's going on with your body.
And so important to know, how can you treat something if you're not treating what's necessary,
exactly
what you have. So definitely important to get that diagnosis.
Yes. So one of the advantages we have in dermatology is that we have direct access to the organ we want to treat.
Right. We see it every day.
We see it every day. It's there. We can put something on it. And sometimes you want to use an oral medicine if you want to. It's easier to swallow a pill. It's going to get everywhere you want it to go. But you're more at risk of having side effects because sometimes it's going to affect things you don't want it to affect and go places you don't want it to go. So it's nice to be very targeted,
right,
and be able to just apply a topical. So that's one of the advantages of using a topical medicine. And with hair, if you could just apply something and not have to be as concerned about it having effects on other parts of your body, that's great. Basically, finasteride is a great drug. I mean, taken orally, it's FDA approved, and it even has some good side effects, like it reduces the risk of less aggressive types of prostate cancer. But it has some side effects that people don't want, like sexual side effects and rare gynecomastia, male breast development. So they've done a study comparing oral and topical finasteride, and they were shown to be equally as effective, which is nice, but topical finasteride does not have any of those side effects that oral finasteride has. So it's nice to have access to a product. It's not readily available at your local pharmacy,
Right.
the topical version of finasteride, but SKNV has a product that has topical finasteride.
What is one thing you cannot leave home without?
My keys.
Favorite part of your job?
I like solving problems.
Early bird or night owl?
Early bird, but that would be more for work. I can also stay up late for fun.
What's the best part of living in New York?
The idea that there's just so much to do and so many opportunities that there's just, you're not going to exhaust it. It's going to exhaust you.
What are your favorite pizza toppings?
Onion. And that would be at Modern Pizza in New Haven specifically.
Give them a plug. What's the first thing you do in the morning?
Make coffee.
All right. We have that in common.
Yes.
Preferred way to unwind after a long day?
Depends on how long, but probably just doing nothing if it's been a long day.
Resting, finally.
Yeah, just lying on the couch doing that.
Well, Dr. Strachan, we loved having you, and thanks for being a guest on SKNV DermTalks.
It's my pleasure.
And then where can our listeners find you?
You can find me on LinkedIn at Dr. Dina MD, on Instagram at Dr. Dina MD. I also have a website, findablackdoctor.com, to help address healthcare disparities, and at aglowdermatology.com, which is also DinaStrachanMD.com.
Awesome. Thank you.